bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Well, I'm glad you could join us. Having good vision and having the ability to use glasses or contacts, or that comes naturally to most of us, but for people who've suffered spinal cord injuries, it's a whole different deal. And Dr. Ella Faktorovich is with us right now, and she's an ophthalmologist, and we have a program called Focus Independence. And Ella, what you were telling me was that people who suffer those kind of injuries, obviously glasses can be a real handicap.
Absolutely. For patients, most patients wearing glasses and contact lenses can be just a mild nuisance, but for patients who suffered spinal cord injury and who lost mobility in their upper body, in their arms and hands, wearing glasses can be a real disability in addition to the disability that they already have, because if the glasses get dislodged and there is nobody in the room to help reposition the glasses for them, then their world just basically ceases to exist.
Yeah. So are you doing surgery on the eyes to help? How is this program working?
Yes, we're one of the few centers in the United States who are doing vision correction surgery, like LASIK surgery, for example, for patients who have sustained this kind of injury and patients who would want to get out of glasses. And this surgery is free of charge to them.
Okay. Now, the people that you've been treating and the program's been treating, are these sometimes younger veterans, for example, who've been hurt during the war, or anybody who's had any kind of injury, automobile? I mean, there's so many different ways people can get hurt.
Yeah. Unfortunately, there are many different ways that this kind of injury can occur, and there have been quite a range of conditions that have precipitated this. A lot of patients are younger patients. Just last week we had a patient who was 28 years old, but 8 years ago he suffered an incident where there was a snowboarding incident, and he suffered spinal cord injury based on that. Yeah. And so for 8 years he's been
I think that until we were talking, you'd sort of take that for granted. You don't think about the fact that if you do have paralysis and this kind of thing, putting glasses on, taking them off, is a major thing. I mean, it's a major psychological thing as well as a physiological thing.
That's right, and the dependence on having people around you to reposition the glasses for you in case they get dislodged, that is also something that adds to their existing disability. This program was originally started by an ophthalmologist in Kansas City, Dr. Dan Dury, who was inspired when he watched the late Christopher Reeves do a presentation, and he was reading a presentation and the glasses slid, so he had to rely on his wife to reposition the glasses to continue the work that he was talking about, and so this inspired the program.
And you realize at that time what a problem that can be. Now, the people who get into this program, is it federally funded? Does the government help? I mean, how is it paid for?
This is funded by the clinics. That's correct. This is a program that's funded by the doctors who participate in it. There are several centers around the country who do that, and it is privately funded for all the patients.
And as you said, it's a national program.
Yes.
National program. Like that. Now, what about is the follow-up program? I mean, if someone has surgery on their eyes, there's follow-up programs. There's a lot of things involved in that. It's not just go in and go out.
Yeah, that's correct. The screening process for these patients is the same as we do for everyone who is interested in vision correction surgery. So the guidelines to getting this procedure done by these patients are the same as for everybody else who is interested in having their vision corrected. They got to be 18 years old and older, have healthy eyes, healthy corneas. So they go through the very rigorous process just as other patients do, which I think that is, of course, important for everybody who is interested in vision correction surgery, but it's especially critical for these vulnerable patients who are relying on their eyesight as one of the few remaining faculties they have left.
That's functioning. Doctor, nice to have you here. Dr. Ella Faktorovich is our guest, and she's an ophthalmologist, and she's in a program called Focus Independence. Thank you very much for watching.